I've been talking about Obamacare, or PPACA, or as it says on the slide here, Patient Protection and Affordable Care Act, on my blog for a long time. And I'm still amazed at how many people don't really know what the provisions are. Now, I'm only going to be talking about how PPACA, or Obamacare, applies to those in business, whether you're self-employed or businesses themselves, on this discussion. If you want to know what goes on for individuals, then you'll have to contact me separately. But I'm specifically talking about the business provisions of PPACA. Some of the provisions that have come about already are that the insurance companies now have to justify how much money they're charging. They can no longer hit us up for premiums that don't provide at least 85% of what we pay as benefits for our employees. And if you're an individual, then it's 80%. Moreover, any rate hikes they want to impose are limited to 10%. Otherwise, the state reviews their rates. But the key things are, there are no longer any problems about pre-existing or chronic conditions. They're not going to be able to deny us coverage. They won't be able to charge us higher rates for those situations. Now, if you're a man, you won't like this, but if you're a woman, you will. Nowadays, women and men are charged the same rates. There is a premium for those of us like me who are older employees. But the other good things are, if all small groups are now pooled together, you're no longer singly rated one company at a time to get these ridiculous rate increases that we used to get every single year. There are no longer any annual limits on the amount of coverage the insurance company has to provide. But we must provide a core group of essential health benefits. And we'll get into that later on. And this is all as of 2014. There also is an individual shared responsibility, which I'm sure you've heard about. And you have to go to the marketplace to do that. Yes, that's the web. Yes, it's not working well. But there are ways around it, and I will cover how businesses should be doing with this. The law basically means that all citizens must have insurance, either through their employer or obtained personally by 1 January 2014. Here's one of the things that people don't understand. The penalty for failure to have insurance for less than 9 months of the year is the greater of 1% of your household income, or $95. It's $95. The employer shared responsibility doesn't start for another year till January 2015. And there are reporting requirements, which we'll get into, including listing how much money you're paying on behalf of your employee on their W-2s. Which means we need to define a few things. What's a full-time employee? A full-time employee is any employee that works 30 hours or more a week, or you pay more than 130 hours a month of work for them. But there's also what they call a full-time equivalent. And that means any 2 or more part-timers who together average 30 hours a week or 130 hours a month, as long as they work more than 13 weeks a year. So seasonal employees are not in this. So what does that really mean? Well, as you can see, we have self-employed, we have those that have 1 to 24 employees, those that have 25 to 49 employees, and those that have 50 or more employees. And you'll notice further that this covers all entities, businesses, nonprofits. First of all, let's deal with self-employed business owners. They either have to have qualifying, I should have put quotes around that, health insurance, or they have to qualify for an exemption. You see there's 2 stars, we'll explain that in a second. Or they get stuck with paying the individual shared responsibility, or ISR, tax. That's that 1% or $95. That number goes up in 2015 to $325, or 2% of household income, and in 2016 it hits 2.5% of household income, or $695, whichever is greater, smaller. So the first thing we need to do is define what happens for self-employed persons or those who have to acquire insurance for themselves and theirs. The ISR, the exemptions are if the coverage that you are going to buy exceeds 8% of your household income, you don't have to have an individual shared responsibility tax. If you were covered for insurance except for any period of less than 3 consecutive months, you're exempt. You could qualify for Medicare if you lived in a state that provided that benefit. For example, right now we still don't know if Virginia will. So if it doesn't, and you were supposed to be covered by Medicare based upon your income, you're exempt. And anybody who practices a religion that Social Security Administration accepts as exempt from healthcare is also exempt. But more importantly, how do you qualify for the premium tax credits? The rule is you must buy your insurance on the marketplace. Yes, that means if you bought it from a broker or directly from an insurance company, you don't get the credit. It also means your adjusted gross income, AGI, is less than 400% of the federal poverty level for your filing status, whether that's single, married, HOH, out of household, or whatever. If you make less than 100% of the federal poverty level, you're on Medicare. It's actually more than that, but that's the reason why we don't worry about it. And you cannot be eligible for any government-sponsored program. That's why if you're covered by Medicaid, you're not going to get the credit. How do you get the credit? You've gone through and registered and provided all your information on the marketplace. That's the healthcare.gov website. You've chosen your insurance plan. And then what happens is you pay a portion of the bill, and the credit to which you're entitled goes directly to the insurer, and that pays the bill in full. So you may or may not have to pay $100 a month. You may be entitled to afford it. And that's for self-employed individuals. Any businesses that have between 1 and 24 employees or full-time equivalents thereto. First of all, there is no federal mandate that you must provide health insurance for your employees. However, you may find that you need to offer health insurance to get the employees you want, and you are entitled to a small business health care tax credit if you do provide insurance with 2 provisos. The average salaries of the employees in your firm does not exceed $50,000, and you, the employer, pays 50% of the employee portion, not the family, of the premium. So if the insurance premium is $400, of which if it was just a single person, it would be $310. Even though it's $400 premium, you only have to pay $155 or more of that $400 premium to be entitled to the tax. If you have less than 10 full-time equivalent employees and your average salary that you pay is less than $25,000, you're going to get the maximum tax credit. You still get one if you have 25 employees and pay up to $50,000, but it's a sliding scale from the 10 FTEs at $25K on up. But starting 2014, to get that credit, you must purchase your insurance from the healthcare marketplace. There is a caveat from 2010 to 2013. I'll get to that next. Moreover, as you see here, if you own, and a lot of people do, 2 or more that you consider unrelated companies, but you have similar ownerships, that's not quite clear what percentage it's going to be, but it's certainly going to be if 70% of the stock in 2 companies is owned by the same people. You're not 2 companies. You're 1 company, and the employees from both companies, or 3 or 4 or 5, get added together to see how you're covered by. Now, what about the Small Business Healthcare Tax Credit, or the HCTC? For 2010 to 2013, that credit is up to 35%. And you have to claim this credit by the tax year's end. And because there is no marketplace, you can get the credit without using the marketplace. But starting 2014, that credit maximizes out at 50%. But here's the other caveat. You can only get the credit for any 2 consecutive tax years. So if you are going to provide insurance and you think your employee base is going to increase, you may want to wait a little bit before you decide to go for the tax credit. Compute it, but then figure out what it's going to be worth to you next year and the year after that. Moreover, the state that you live in. As I said before, to qualify for the small business healthcare tax credit, you need to have 25 or fewer full-time equivalent employees. The average salary for all the employees on a full-time basis is less than $50,000. So if you have 2 part-time employees, each making $31,000, that's a $62,000 salary, but that may or may not change the average salary for all your employees. And again, you, the employer, must pay for at least 50% of the employee's health care. The employee himself or herself pays for none, some, or all of the dependents. That's up to how you want to do it. But you're not responsible. Larger companies, those that have 25 to 49 full-time or full-time employee equivalents, you're still not required to provide health insurance. Most of them do. And the key point here is, you'll notice, you're not entitled to a tax credit. But your state may have it. I can tell you Virginia doesn't. You can purchase insurance via the marketplace. That's up to you. All companies that have 50 or more full-time employees or their equivalents starting 1 January 2015, so that's not this January, it's January next, you must, M-U-S-T, provide qualifying health insurance to no less than 95% of your full-time, not the equivalents, but the full-time employees and their dependents. If you don't, you're subject to the employer shared responsibility tax. And as you can see from the title line, it's been done 1 year till 2015. The other fact, since most businesses in America have fewer than 50 employees, it means that 96% or more of all the businesses in America are exempt from requiring to provide health to their employees. So how does a big company become subject to the tax? There's 2 scenarios. The first one is you either fail to offer insurance to 95% of your full-time employees, or you do offer insurance, but it's either unaffordable or fails to provide some minimally. So let's look at scenario 1, the failure to provide adequate insurance. If any full-time employee signs up for insurance on the marketplace and that employee gets a tax credit, bingo, that's the alarm, you're subject to the tax. What's the tax? It's $2,000 a year or $166.67 for each month that coverage was not afforded. This only applies to the full-time employees. Moreover, it only applies to the first 30 of your employees that are not included. So let me give you some examples. You have 30 real full-time employees and 47 part-timers, which means your total full-time equivalent employment is 54. Since the tax does not apply to the first 30 employees, you'll never be hit with a tax. But now you have 42 employees that are full-time, as you can see in the next scenario, of which 35 are part-time in the same full-time equivalent. The tax still doesn't apply to the first 30 employees, but you have 42, so there's 12 employees times $2,000, and you get hit with a maximum tax of $24,000. But again, if no employees got a tax credit, that means they were paid too much, more than 400% of the federal poverty line, they're not going to get a credit. You're not going to get hit with a penalty. Remember that. If you're paying more than the poverty level for your employees, there is no penalty. Scenario 2. It's not affordable or it's below the minimum value offered. If any employee in this scenario gets a premium credit, then your tax is a little bit more. It's $3,000 a year or $250 for any month the condition applies. The tax is imposed for each employee who gets that premium credit. However, it can never exceed the tax as computed by scenario 1 that we just went over. So let's look at some examples. You have 2 employees that get credits. So the maximum tax you're subject to is $6,000 a year. The first scenario that we did before was 30 full-time employees, 47 part-timers, FTE employment of 54. It doesn't apply to the first 30 employees, so no tax. The second scenario, 42 full-timers, 35 part-timers, same FTE of 54. The tax does not apply to the first 30 employees. The maximum tax, that's not the one you're going to get hit with, but the maximum tax, which is what applies from scenario 1, is $24,000, but you owe $6,000, 2 employees times $3,000. So now we need to know what's the minimum value insurance, because that's one of the criteria that doesn't make us subject to the tax. The plan you're offering your employees has to cover 60% of the total costs. If the doctor visits $200, for example, your plan can't leave the guy or the gal with paying $80 for each of those visits. It has to be less than $80. If there's a hospital bill of $5,000, the employee can't be responsible for more than $2,000. Sometime in 2015, the government will have a site, yeah, I know, don't laugh now, probably at cms.gov, that will let you plug in the details of your plan to determine if you meet the minimum value. But what's affordable insurance? It's defined as the cost that your employee pays for insurance not exceeding 9.5% of his or her household income. Remember, you have to offer insurance to all full-time, not full-time equivalent, full-time employees and their dependents. That's anyone up to the age of 26. It may mean their mother or father if they're caring for them, and deduct them. Spousal coverage is not required. Now, here's your little safety valve. You have to list the employee paid portion and the health insurance on their W-2s now. And if that value that they're paying is less than 9.5% of what you're paying them in gross wages, you are not liable for providing them non-affordable insurance because you did your... And what is this marketplace? Well, it's healthcare.gov. A scenario I suggest you do is, I don't care which of the 50 states you live in, please go to healthcare.gov first. When you put in your state, it will tell you, ding dong, ding dong, ding dong, you are covered by your own state, and they'll give you a link to go to the correct state plan. Why am I telling you that? There are too many charlatans out there trying to scam you and get information and dollars. Healthcare.gov will always work and get you to the right place. I'm not saying you're not smart enough to do it anyway without it, but I'm just saying, as a safety valve, please go to healthcare.gov. Let them tell you when you have to go to another site, and they'll give you the link. So if you're on the individual healthcare insurance marketplace, that's for all the self-employed individuals or those individuals who are not offered insurance at work. Otherwise, you go to SHOP. That's the Small Business Health Options Program. Any small business with fewer than 50 full-time equivalents may enroll this calendar year. In 2016, those small businesses with up to 100 full-time equivalent enroll. How would I suggest you do the SHOP? Go to the healthcare.gov, download the application, fill it in, print it, mail it in. Yes, from the guy who hates paper, use paper. If you do this now, you should be notified well before 15 December if you're going to be covered and how much it will be. You can always go to the website later, but right now, this is the way to get the insurance for you and your employees. The employees will then enroll online and complete the application process at the... What is minimum essential coverage? Well, there are 5 flavors of it, but not really. There's the platinum, which covers 90% of the cost, the gold for 80%, silver 70%, bronze 60%. Anyone who's under 30 can purchase catastrophic coverage. Everybody else needs to use bronze, silver, gold, or platinum, except President Obama just extended catastrophic coverage to all those who had such coverage in place before October 2013 for one more year, to keep the promise that is very confusing and wrong, saying if you like your insurance, you get to keep. Here you see a list of all the essential health benefits. I'm not going to read it. You're probably capable of doing that. And that will cover what you really, really need to know. But there are some qualifying health insurances. If you're on Medicare, Part A, or you're covered by Medicaid, you've got qualified health insurance. If an individual is covered by his employer, whether that's COBRA or retired, it's covered. If you have spousal or parental coverage, it's covered. Those who are from the U.S. military get covered by TRICARE, some of the veterans' coverages, and any insurance policy purchased on the marketplace is considered qualifying health insurance. Notice, going to your favorite insurance company and buying insurance if you're an individual is not qualifying. Now we have a few gimmicks, loopholes, whatever term you want. I need to define three terms first. The first one is there's a look-back measurement period. That means we have to determine the full-time equivalent status, and you can pick anything from 3 to 12 months in 2014. You get to choose what it is. But whatever you pick as the measurement period is going to set the stability or coverage period. And that's after the look-back period, the greater of 6 months or the length of that measurement period. Yes, did you read that carefully? You probably can miss needing insurance for all of 2015 if you do it that way. That's pretty amazing. Now there is an administrative period to give you some time that you can set up the system, because don't forget you have to have your employees enrolled, so that will change it also. That's what sets your insurance plan. There are a few other gimmicks or problems, at least in my mind. We talked about how you can get hit for the tax. If you have one employee who is subject to or entitled to the premium credit, and you fire that person and is no longer your employee, it's not exactly what they want, but it looks to me like you will not be subject to the tax except for maybe for 1 month.